Everything I do is very subtle. It just needs a little enhancement, and that's what I like doing. It's like taking a Rembrandt and just kind of fine-tuning it and restoring it. If you break it down in plastic surgery, it's about the face. My goal is always, anything I do, whether noses or injections with Botox, I want the movement. I want everything to look natural, and I think there lies the art, and it distinguishes one doctor from another, one surgeon, one artist from another. Scarlett, what we're going to do, instead of filing this bump down, because there's a little bit of a hook effect, I think the better thing to do will be to enhance this. This is called the glabellar area, and the bones are not as strong. So I want to create the effect, the visual effect, that this is fuller. So now it doesn't look like a hook, it's much more in balance. So if I can fill this area right there a little bit, the nose looks straighter and it gets rid of the hook effect. The bridge of her nose, where the nose begins from the forehead, was a little shallow, which made the rest of the nose disproportionately big compared to the shallow beginning. So instead of shaving down the lower part of the bridge, I said if I fill where she is shallow, the beginning of the nose, then I'm going to create better proportion and save her surgery. So from right here, half a drop, one drop, one drop, one drop, one drop, half a drop. So you just gradually create this filler effect right here, so it comes in line with your cartilage profile. Instead of lowering the cartilage profile, it'd be nice to build up the bony profile right there. Nose injections last all the way up to 2 years. We have seen, it's very surprising, pleasantly surprising, that the same Juvederm lasts less in the cheeks than in the nose. But the range is from 6 months to 2 years. So what I'm doing now is sterilizing the area with betadine sponge, because nose being a closed space, we can't afford to have any chances with infection. On the nose, we tell our patients not to touch the site for a couple hours, because the needle holes, they're supposed to close within 30 seconds, but if they don't, then they can introduce some infection. And then also, prophylactically, we give them one antibiotic that moment and one for next day, just to make sure that it's covered, because the nose is sort of a closed space right there. Look at how straight the profile looks now, huh? In 10 minutes, you have a new nose. There's very specific facial structures that you can enhance them. If there's a little indentation from an injury and the nose looks crooked, it looks a little pushed, and the patient is not interested in surgical rhinoplasty, then we can create a visual improvement by filling that indent with 0.3, 0.4 cc's of hyaluronic acid, Juvederm or Restylane. In a lot of Asian patients, because if the bridge is not developed, the bones look wide and you're creating an illusion of narrower bones right here. The only downside to this is that you might have to do another little session in a year, a couple more drops, but so be it. It's so natural, no downtime, no anesthesia, no surgery. You can enhance the nose. Certain noses, if the nose is really big, you can't enhance it because it's going to get bigger. But this is perfect because she's got great cheekbones, and you need to build the bridge a little bit. You need to increase the height to complement her high cheekbones, complement her eyes. And that's what we were able to accomplish with the 10-minute injection with Juvederm. The same thing cannot be applied to a Grecian nose, where the nose starts very high, has a huge bump, and then you can't take that nose and fill it again. At the beginning of the nose, it'll become much bigger. That nose needs to be surgically shaved. He needs to have a surgical rhinoplasty, or she does. Looks really cool. Yeah, looks nice.